Madam President, as we head into the holiday season, parents and doctors nationwide are concerned about a dramatic surge in an illness called RSV, respiratory virus. It can be especially serious for children and older Americans. As a parent, there's no more terrifying or helpless feeling than knowing that your baby's sick. I know. I lived it. Caitlin Berg experienced that fear recently, too, when her 6-month-old daughter became ill with RSV and was struggling to breathe. The Bergs live in Mount Zion, Illinois, a small town downstate near Springfield. Caitlin Berg scoured the area looking for a hospital that would cure her sick daughter. After many frantic calls, she finally decided Springfield was the closest town with a hospital. She took her baby there and waited 8 hours in an emergency room before a bed finally opened up for her daughter. Caitlin Berg, incidentally, is a pediatrician. If a pediatrician has to struggle to find hospital care for her own sick infant, imagine the panic and fear other parents feel when their babies are struggling to breathe because of RSV. And it isn't just a problem in small town or rural America. Chicago is the 3rd largest city in our country, some of the best hospitals in the world, including some of the very best children's hospitals. The rate of emergency room visits for young children with RSV is now 10 times higher than in 2019, 10 times higher than a normal season 3 years ago. This chart demonstrates that. Look at this spike. As you can see, the number of children admitted from RSV is skyrocketing. In Chicago alone, there are hundreds of new cases each week, and nearly a dozen kids each day being hospitalized. Earlier this month, Comer Children's Hospital at the University of Chicago was full, with no beds, for 53 straight days. And Lurie Children's Hospital in Chicago also running at full capacity. 95% of pediatric ICU beds across Illinois are full during this time. This crush on pediatric hospitals isn't limited to Illinois. Over the border in Franklin, Indiana, little Ophelia, you can see here in the bed, struggled to breathe after contracting RSV at preschool. She went to the local hospital and they transferred her to the large children's hospital in Indianapolis, where she was intubated for 5 days. Thankfully, she's home safely now and recovered. Across the country, children's hospitals are being pushed to the limit, caring for infants, toddlers, and young kids sickened by RSV. In extreme cases, kids and babies may require ventilators to breathe. The timing of this surge in RSV is especially concerning, coming during the worst flu season in a decade and while new COVID variants are circulating. Those 3 viral variants together pose what many health professionals argue could be a triple-demic of viral illness. So let's look for solutions. The Children's Hospital Association, the American Academy of Pediatrics, has asked this president to issue an emergency declaration to free up more resources. I support them. At the top of the list, America desperately needs more nurses, more doctors, more staff. Hospitals plagued with worker shortage even before COVID now have a pandemic that's made the crisis even worse. If our children's hospital had more staff, they could immediately open more beds to treat the kids. Congress made some headway in the American Rescue Plan, which passed on the floor of the Senate without the support of a single Republican senator. It included my provision to invest $1 billion in the National Health Service Corps for scholarships and loan repayments for new nurses and doctors who serve in urban and rural areas in need. But we need to do more than end the healthcare worker shortage. Senators Menendez, Bozeman, and Schumer have a bipartisan plan which I support. It increases funding for medical residency slots to train the next generation of doctors, nurses, and other medical professionals. I support putting that plan in the end-of-the-year package we'll consider in the next few weeks. It's also critical that we fund our public health system adequately and provide for data collection so we can track RSV. The Health Committee has been working on this priority, and I certainly support their efforts. Madam President, we're all in this together. The hospitals are doing their best. Doctors and nurses are working extra long shifts to keep kids safe. We all need to do our part too. For all of us, that means staying home when we're sick, still washing our hands, getting COVID booster and flu shots. For those of us in Congress, it also means providing the resources to get safely through this current surge of RSV and building the strong public health infrastructure which American families require.